Kevin Ogutu, KTN News.
And still on the same, while home-based care for COVID-19 patients has continued to be the option for the government, a majority of those living in slums or informal settlements term it as a nightmare with no proper arrangement to protect their loved ones and neighbors. Monica Akelo and Mildred Atieno are residents of Kibra slums, and they say they're now forced to be on their own as their environment cannot allow them to isolate without exposing others. Our reporter Cecilia Wakesha Madhuva with details of that story.
In Nairobi's Kibra slums, we meet Monica Akelo, who believes she recovered from the novel coronavirus. Together with her husband, they were among COVID-19 patients who were at Kenyatta University Hospital Isolation Center when the Ministry of Health gave a go-ahead for asymptomatic patients to be isolated at home.
Tulienda na swali kwa moyo juu tulishindwa hapa Kibira utajiasilete wapi, na nyumba ni moja, jikoni ni moja, mnalala kwa nyumba moja.
A mother of 4 and her husband had no choice but to join the society even without proper strategy on how they will prevent them from contracting the coronavirus. To date, the ministry is yet to test whether they recovered or not.
Tulishindwa juu kama niko na ugonjwa na sijatoka negative na nimeambiwa nirudi nyumbani na nyumbani niko na watoto. Sasa watasaidika aje kama mimi nimetayari maybe ninaweza kuwa nimerudi na ugonjwa.
Kuna watoto wawili walienda huko na baba yao, vile walirudi so tuliambiwa wakae kwa nyumba wasitoke nje. So walikuwa tu kwa nyumba, lakini kitu ngumu, tunaishi hapa Kibira, tunashare choo, tunashare bafu. So ingebidi tu waende choo juu hawangeenda choo kwa nyumba. Lazima waende choo, na hapa tunaishi mlango kama 20.
According to the Ministry of Health, 78% of COVID-19 patients are asymptomatic. The ministry guidelines, among others, propose that patients should be placed in a dedicated, separate and well-ventilated isolation room. Their movement in the house is also limited, and time spent in shared spaces like kitchen and washrooms is minimized. They should have dedicated linen and eating utensils, which should be disinfected immediately after use by the patient.
Juu venye nilienda quarantine ndio nilikuwa nasikia Kibira inazidi. Sasa mtu akijileta aende apimwe ndio ajue ako na ugonjwa ndio ataenda isolation ndio watambeba. Na je, wale wajajitolea kuenda kupimwa watapatikana namna gani ama watatengwa namna gani?
We shall explore and see, do we have an online module, a modular format where you're able to see how do I clean my dishes when I'm having home-based care? How do I prepare 0.5% jik? That's an important component of home-based care. How do I wipe my kitchen countertop? How do I disinfect our clothes, our bed sheets, our linen during the home-based care program?
And as Nairobi City County continues to record the highest number of coronavirus cases, Monica and Mel